Protection against the swine flu is going to be delayed for millions of Americans. Federal officials now say that only about a third of the swine flu vaccine the country was counting on will be available by mid-October. That's when the mass vaccination campaign is scheduled to begin. Here's John McKenzie.
It is the single best hope of slowing the spread of swine flu. But health officials now say this new vaccine will not be available as quickly as planned. Instead of 120 million doses by mid-October, there will now be only 45 million doses, with another 20 million arriving each week after that. In short, this vaccination program is going to be at least a month behind schedule. The government had hoped that almost everyone needing to be vaccinated would have received their shots by the first week of December. That is not going to happen.
Because of this delay, it's more likely that this virus will cause more illness, more hospitalizations, and even more deaths in our country than we anticipated.
There are 5 companies making the swine flu vaccine for the U.S. market. Health officials say some have been delayed finishing up production of seasonal flu vaccines. But the biggest problem has been how slowly this particular swine flu virus grows inside eggs, the critical element of vaccine production. The net effect?
I think it's likely that we'll focus in more tightly on the priority groups. Pregnant women and healthcare workers will be at the top of the list, as will young children.
Students had just returned to class at this Stockbridge, Georgia school when they were welcomed by the swine flu.
We talked to CDC and looked on their website to see how to handle these things.
At Duke University, almost half the varsity football team has come down with flu-like symptoms. As Americans prepare for the next wave of this pandemic, they will be doing so without all the vaccine that's so urgently needed. John McKenzie, ABC News, New York.